Only women are responsible for fertility issues.
Certainly no.
Using birth control for years can make it harder to conceive later.
No, absolutely not. Nowadays, very low dose pills are available which have got minimal side effects and no impacts on the fertility. You would be surprised to know that there is a significant reduction in the global sperm count. The men who are doing at least 3 hours of physical activity in a week, their sperm motility is 50% higher compared to the ones who are not doing any physical activity.
I wanted to also understand a little bit around this entire advent of C-sections and how, there are reports on it is much more practiced in India versus the West.
Urban India, certainly we are seeing a rising trend for cesarean sections, and there are a number of reasons for it.
Age is a major risk factor for infertility.
Yes. See, the ideal age group to conceive is before the age of 30 years. After 30, the fertility declines. So what I'm trying to educate people is that please be aware that there's a clock ticking. So while you're focusing on careers, please bear it in mind that there's this biological clock which is going the other way.
Hello everyone, this is Khushbu, founder at Zyla Health. I'm very pleased to welcome you to this very special edition of Conversations with Zyla on the occasion of International Women's Day. What better occasion than today to welcome our very esteemed speaker and guest, Dr. Bhavna Chaudhary, who has 30 years of experience in Obs and Gynae field and currently the Senior Director and Unit Head of Obs and Gynae at Max Healthcare Gurgaon. Very warm welcome, ma'am.
My pleasure to be here with you, Khushbu.
Thank you so much. Dr. Bhavna has completed her MBBS from PGIMS Rohtak, followed by her MD in Obs and Gynae from PGI Rohtak. She has also received advanced training in minimally invasive surgery from AIIMS Delhi and holds a diploma in advanced gynecological processes from Germany. Very proud to have you on the show today, ma'am. On the occasion of International Women's Day, we will cover a very important topic: fertility matters, hers and his. So far till date, we have seen that fertility has been solely thought of as a woman's responsibility. But we know that conceiving is actually a shared responsibility. Breaking the stigma, we bring to you a very important topic on fertility, and not just talking about women, but also men equally. So, Dr. Bhavna, today we will explore varied topics on fertility, very, very critical, especially for folks in the city struggling with misconceptions and myths around fertility. Before we start, I would like to engage you in a rapid fire round, and I'll request you to answer in just yes or no so that our audiences can get the maximum in a few minutes from Dr. Bhavna.
Sure.
So, shall we start?
Oh, yes.
Great. So, Dr. Bhavna, the first question: only women are responsible for fertility issues.
Certainly no. Men are equally responsible.
Great. Men don't have a biological clock.
They do. They do have a biological clock, of course, yes.
So answer is no. Men have a biological clock.
Yes.
Certain foods can boost fertility overnight.
See, they do not boost it overnight, but yes, certain foods do affect fertility.
Great. Using birth control for years can make it harder to conceive later.
No, absolutely not.
Age is a major risk factor for infertility.
Yes.
Stress is a major risk factor for fertility.
Yes.
IVF always leads to twins or triplets.
No, not always.
If you've had a child before, you can't face infertility.
No, you can certainly face infertility even after that.
Great. Thank you so much, Dr. Bhavna, for busting these very critical myths in such a short time. Our audience has definitely gained these valuable insights. And now just moving on, I'm very, very excited to uncover the topics in detail so that when our audiences leave today, they have a very sound understanding of what fertility means and how they can, go forward with their conception journey.
Sure.
So just talking about the fertility trends in India, Dr. Bhavna, we've seen that, it's changing quite a bit in India. We are seeing that in cities, a lot of infertility treatments have seen a rampant rise. What do you think are the root causes for this?
See, worldwide and also in India, the trends are changing. You have rightly put. So earlier, if we look at the trends in the 70s and the 80s, the general fertility rates were like average 5.2. So when I mean these fertility rates, and a woman would average have approximately 5 children, but now the trends that we are seeing, it has come down to around 2. That's the trend in the 2023 and 2024. So that is the latest trend. So overall, the fertility rates are going down and infertility is on the rise. Somewhere it is a result of development, that people are now delaying their pregnancies, they are more career oriented and they want to put it off till later. And others are because of the lifestyle that they are actually facing problems in conceiving. So what is happening to our lifestyle? There is a lot of stress, there is a market shift in the eating habits, sedentary lifestyles leading to obesity and leading to a lot of hormonal issues also along with it. So the general trend towards decreasing fertility is being seen, and it is seen both in men and in women also. And added to it is the environmental pollutants, the environmental toxins, which have a very deleterious effect on the gametes as well. If I give you a simple example of men, you would be surprised to know that there is a significant reduction in the global sperm count. In 1980s, while in men we would consider 40 million per ml as the normal sperm count, and now in the last 40 decades it has globally reduced almost 50%, and we have now, WHO has now you can say given new parameters wherein 15 million per ml is the new normal sperm count. So everything is having a impact on the impact on fertility, and the fertility is coming down.
So, and ma'am, if I had to just add on to that, what do you think is the reason for the lowering sperm count in men?
Okay, see, as I said, the lifestyles are changing. People are having more stressful lives, and stress affects hormones. So in men we are seeing that the testosterone levels are coming down, estrogen levels are rising, the sperm counts, that is why, are coming down, and not only the counts, the sperm motility, the normal you can say the morphology of the sperms is also getting affected. So one, I said stress, other I said the sedentary lifestyle leading to increase in obesity, then the kind of foods that we are consuming. See, we are consuming lots and lots of junk foods. Again, all this has a negative impact on sperm formation, spermatogenesis. So that is why there is a global reduction in the sperm count.
Thank you, ma'am. So what you're saying, Dr. Bhavna, is that it is not just the women who are facing fertility issues, but equally the men. And you gave us some staggering facts around sperm count per million that, the WHO has now presented new sort of standards for it. That's quite eye-opening. Thank you so much. And now, if I just go gender by gender, and we'll cover some aspects. So first, talking about women, right? There is a deep link between menstruation, ovulation, and conception. So if you could just demystify this for our audience, that how this all links up and how eventually a woman conceives.
See, menstrual cycle is an indicator of a woman's reproductive health, right? So normally a woman tends to have a 28-day rhythm, and if she has a regular cycle, that means more or less her hormones are in a balance. But 28-day cycle doesn't hold true for everyone. There may be a variation from 21 to 35 days. But for every woman, it is more or less defined. Like if some lady has a slightly shorter cycle, 21 or 22 day cycle, then it is that for her every month, right? And some people may have a longer cycle, say 34 or 35 days. But what is important is that she is getting her periods regularly in a rhythm during that cycle. On an average, it is 28-day cycle. And in that 28-day cycle, somewhere during the middle of the cycle, say around the 14th or the 15th day, an egg is released. So something that we call an ovulation. So the middle portion of our cycle is the fertile period for a woman. And there are certain hormones which are governing this menstrual cycle. So the important hormones are FSH and LH. The follicle stimulating hormones, which stimulates the growth of follicles in the ovaries of the woman. Then there is a trigger of a hormone called the LH. We call it the LH surge, which causes the release of that egg from the ovary. And then there are other hormones like the estrogen and the progesterone, which ensure that when the egg is released from the ovary, the lining of the uterus also grows well, so that when the egg is released and it is fertilized, it is nicely implanted and the pregnancy is supported. So the menstrual cycle tells us a lot about a woman's, you can say, the hormonal well-being. So if she has a regular menstrual cycle, there is a very good chance that her hormones are in a balance. And when she is having irregular cycles, it is an indicator that she is perhaps suffering from some hormonal imbalance, and that has a bearing on her fertility. That means that the eggs are not forming properly, the chances of ovulation, the release of eggs, the implantation, and the maintenance of pregnancy would then be negatively impacted.
Great. Ma'am, we'll cover the symptoms in a bit, but just before that, you cover a very important aspect of the menstrual cycle and how a woman has a fertility window, which is usually mid of the cycle. If you could help us also relate this with ovulation, and if someone is trying to conceive, how do they read their ovulation cycle and when they should be trying to conceive naturally?
Khushbu, that's a very valid question you have asked, and women usually are confused which is the fertile period of our cycle. See, it's easy to predict in a lady who has got very regular cycles. So as I said, that on an average women have a 28 or a 29 day cycle, and it's easy for us to predict that the ovulation would happen somewhere during the middle of the cycle, that is the 14th day. And the couple of days surrounding that day is the most fertile period. So you can say somewhere starting from the 12th or the 16th or 17th day of the cycle, those 5-6 days are the most fertile period of our cycle. In women, where the periods are very erratic, there it becomes a little difficult to predict. But now in the market, some ovulation kits are available. So you can do a test with those kits. I mean, they're very simple, like you have the pregnancy cards and all to check for pregnancy. So similarly, these ovulation kits can guide you when the ovulation is about to happen.
It's a urine test.
It's a urine test, yes, exactly. And of course, we have an ultrasound also to help track the development of follicles and the eggs in your ovary, and will tell you exactly when the egg gets released. So the ultrasound we do not need to do again and again. Maybe we can do in 1 or 2 cycles to figure out how the pattern for a particular woman is, in case she is having irregular periods or in case she is having difficulty in conceiving.
Got it. Great. And these ovulation strips or kits that you mentioned, Dr. Bhavna, how accurate are they? Can they give false negatives, false positives?
Yes, they can sometimes give you false negatives, false positives, but more or less they just give you some basic idea. So for people who are having very erratic cycles, they are a guide. They can guide you what are the fertile days of the cycle. But yes, as you pointed out, they may not be 100% correct.
Got it. So what you're saying is, for someone who has 28 day to 29 day cycle, usually 12 to 17 day is the fertile period.
Exactly.
Someone who has an irregular cycle needs to either use ovulation strips, which may be correct or incorrect sometimes. So
mostly
an ultrasound.
They are correct. Mostly yes. They are correct. But yes,
there can be some.
There can be some error once in a while. Yes.
Got it. Great. And now just transposing this question to men. And you spoke about sperm count and ability to conceive. For men, there is no such cycle, correct? But are there days which are good for men? Are there things which are good for men in terms of ability to conceive?
See, well, men do not have a cycle of sperm protection. But if you want to know what improves fertility in men, yes, the general things, as I have been repeatedly telling you during my conversation here with you, that 1, stress. Men should learn how to de-stress. Then mindful eating and a healthy balanced diet, which is packed with nutrients, and reduction in the intake of junk foods, processed foods, high sugar contents, limited intake of alcohol, and smoking should absolutely be given up. So all these general things improve the sperm counts and fertility in men. And one important thing, regular exercise. See, a recent study by AIMS, a 2023 study, you would be surprised. It shows that the men who are doing at least 3 hours of physical activity in a week, their sperm motility is 50% higher compared to the ones who are not doing any physical activity.
Wow.
And environmental pollution does have a role, but we can't do much about it. So the things that are in our control, yes, of course.
Makes sense. And similar things apply to women, of course. You mentioned around lifestyle, right? Okay, great. And Dr. Bhavna, if we have to now turn the tables to a different topic, contraceptives, right? Which is a very, very, again, confusing topic for women. Which contraceptives are safe, not safe? Someone who's never had a child versus someone who's just had a child. What should be the contraceptive of choice? And are there any, related side effects towards fertility?
See, contraceptives are very empowering for women. They give her the ability to choose when to get pregnant and when not to get pregnant. So I am a strong advocate of contraception for women. Yes, she should have a pregnancy only when she is prepared to have one. So that goes without saying. Now there's a lot of misconception regarding contraceptives, their effect on pregnancy. See, regarding the oral contraceptives, nowadays very low dose pills are available which have got minimal side effects and no impacts on the fertility. And there is a common myth that if we have been consuming oral contraceptive pills for a long period of time, would I be able to conceive? How long would I take to conceive? See, with most oral contraceptive pills, the moment you stop the pill, within a month or two, there is complete return to fertility. Now, regarding the intrauterine contraceptive devices, something like a copper T or a Mirena, so once we remove, again, almost within a couple of weeks, the fertility is there. In the copper containing IUCDs, it is immediate, but for the hormone containing IUCD like a Mirena, it may take a little longer, but the return to fertility is still quite quick. The only contraceptive which has a delayed return to fertility is the injectable ones like injection Depo-Provera. There sometimes the return to fertility may take 6 to 12 months, but it doesn't certainly make you infertile. So I want to burst that myth once and for all.
Got it. And ma'am, if you could just also elaborate upon the mechanism of action in a very layman terms of the pill and the injection for our audience, so they understand why, there are minimal side effects and the fertility returns.
See, with the oral contraceptive pills, mostly they are combined pills containing estrogen and the progesterone, and they have got multiple mechanisms of action. One is they inhibit the release of egg from the ovary. That is one thing. Secondly, they thicken the cervical mucus so that the movement of sperm up the reproductive tract is hindered. And thirdly, they make the endometrial lining also thin so that implantation doesn't happen. So mostly oral contraceptive pills, they work by this mechanism. Now for the intrauterine contraceptive devices, the copper containing ones make the lining of the uterus hostile for a pregnancy, right? And the progesterone containing ones additionally make the cervical mucus thick and also thin out and make the lining of the uterus unfavorable for an implantation. So that is the mechanism of action.
So these are all temporary mechanisms?
They are all temporary mechanisms. Correct. And we have got injectable ones also, which can be in the form of injection. Again, it's a progesterone. It acts in a similar way. The only difference is the route through which we are giving. Otherwise, the mechanism of action is more or less similar.
Got it. And Dr. Bhavna, there are physical contraceptives also. So what should people prefer, a physical or a oral one or an injectable?
See, when we talk of the physical contraceptives, something like a condom or a diaphragm, the advantage is that the condoms are protecting you from sexually transmitted diseases also. So there is a definite advantage. Secondly, no side effects, because no hormones, nothing. So not even the minimal of side effects. The only thing is that one must remember to use them every single time. So if it is skipped, then there is a failure rate. Otherwise, it's a very good method of contraception.
Got it. So, ma'am, we'll now cover a few segments on fertility. Just before that, because you mentioned the failure rate of contraceptives, if in case a woman gets pregnant with her, say, spouse, and she was not ready, and this is because they failed to use a physical contraceptive as an example, what usually could be an immediate step that one could take?
See, well, it's for the woman to decide that in case she wants to continue a pregnancy, then these things won't have a deleterious effect on the baby and she can continue the pregnancy. That is one. But if she chooses not to continue with this pregnancy, then we have got ways and methods to terminate the pregnancy also.
Okay.
In case a pregnancy happens. And we can take a preemptive step before that also. Suppose a woman skipped using a physical contraception and she had an unprotected intercourse, then in that case, in the market, certain pills for emergency contraception are available which can be taken. Now, they may not work 100% of the times, but they do work 97-98% of the times, and they can prevent a pregnancy.
But we should not overuse or misuse this.
See, it's a once in a blue moon thing that you were really unprepared and something of this sort happened. So once in a while it can be used, but emergency contraception should not be the regular method of contraception, because these are higher doses of hormones that are going into your body and it can throw your normal menstrual cycle out of gear. So for your regular contraception, you should be using a regular method of contraception, be it a physical method like a condom, or it could be a regular contraceptive pill which you are taking in a cyclic way, or it could be an intrauterine device.
Great. Thank you so much, Dr. Bhavna, for covering that. And now just coming to a very critical aspect of fertility and dealing with infertility. We'll first cover the natural mechanisms, Dr. Bhavna. So there is a lot of, again, myth around this food causes infertility and this food causes fertility. If you can help us demystify this.
Yes. See, there is no absolute thing that this food will cause fertility and this food will cause infertility. See, it's the general concept that healthy eating would improve your general health, and it would improve your reproductive health, it would improve the quality of gametes, the eggs and the sperms. So what we say is that your diet has to be balanced with a generous helping of fresh fruits and fresh vegetables. So the focus should be on a protein-rich diet, a diet which is rich in minerals and multivitamins, especially folic acid, vitamin C, and rich in zinc and lycopenes. So green leafy vegetables, then lots of citrus fruits and berries, which are a good source of antioxidants. That makes good sense. And there's a lot of sound around these omega-3 fatty acids because they boost immunity. So the good sources of these omega-3 would be walnuts, chia seeds, flax seeds, and if you are a fish eater, then yes, certain oily fish like salmon are good to improve that.
And this is true for both genders, correct?
This is true for both genders.
Correct. So, Dr. Bhavna, just double clicking on that, right? Given the nutrients you mentioned, there is a lot of noise around nutrient supplements in the market as well, and there is a lot of haste purchases, and there are women and men on multiple multivitamins, supplements, nutritional supplements, and so on. What is your take on that?
See, I always believe that you should get your nutrients from food rather than from the blister packs. The only thing that is proven and makes sense regarding supplementation is folic acid, that whenever you are planning a pregnancy, you should go in for a folic acid supplement. Now, regarding the other nutrients, see, it makes sense to go in for a regular health checkup wherein we do the basic blood tests and we are checking for your vitamin levels also. And if there are specific deficiencies, we can add on that. Like some people may be suffering from vitamin D deficiency or a vitamin B12 deficiency, then we specifically add those. Otherwise, I would prefer that you focus on a healthy diet and just do not
Overpop the pills.
Yes, exactly. So get your nutrition from your food and not from the blister packs.
Thank you so much, Dr. Bhavna, for saying that. I'm a big ambassador of the same.
Yeah.
So you mentioned that women should consider folic acid, and all gynecologists use that as a standard of care. For men, are there any such supplements which are usually prescribed if they are trying to conceive?
No, as I said, the routine health checkups, and if they are suffering from specific deficiencies, then definitely something needs to be added. But don't pop in pills left, right, and center.
Got it. Now, you mentioned about diagnostics, Dr. Bhavna. So, are there any particular diagnostic tests that one should get done when they are planning to conceive, or if they have certain symptoms, if you can cover both?
See, definitely it makes sense to go in for regular annual checkups because there are so many things happening in the body that we do not know. So, doing a regular annual health checkup certainly makes sense. And definitely if you are planning a pregnancy, because there could be so many underlying health conditions that we are not aware of, like hypothyroidism. Sometimes there could be underlying diabetes or borderline sugar levels, or there could be borderline high BP issues and certain deficiencies. So a regular health check makes sense whenever you are planning a pregnancy, and especially if you are planning it late in your life, especially for women who are planning a pregnancy after 30. Certainly it is absolutely mandatory.
Okay, got it. And for these different checkups that you mentioned, are there any, like for example, for men there are sperm tests, and for women there are ultrasounds you mentioned. When are these recommended usually?
See, routinely, if a lady just approaches me that she's planning a pregnancy, she's in her late 20s, I would just advise her a couple of routine blood tests, which would include her complete blood count, her blood sugar levels, her vitamin D and B12 levels, her blood group, whether she has a thalassemia screening has been done or not. So just these routine health checkups. And we can offer her a vaccination for rubella in case she is not already vaccinated for that. But if she has already been trying for a couple of months and she has not been able to achieve a pregnancy, then we would go in for the specialized test where I would want to know whether she is ovulating. So I would want to do her follicle study for that and other specialized tests accordingly.
Got it. Okay. And for men, are there any such similar tests if there is an inability to conceive for say certain?
If there is an inability to conceive, then certainly we need to do a sperm analysis or a semen analysis, and I would want him to meet an andrologist or a urologist also who can look at the physical issues, because sometimes in men who are facing fertility issues, there is a common condition called varicocele, wherein the blood vessels around the testis, they are dilated, and that raises the temperature of the testis and has a very negative impact on spermatogenesis. So that is just one example I quoted. So a physical examination by a urologist also would be important.
Okay, great. So let's take a case, Dr. Bhavna. A couple comes to you and they're perfectly healthy and they have the latest blood test reports. Everything seems to be fine, and say they're in their early 30s, right? Very common in a city scenario that I'm talking about. Now they suppose they've been trying to conceive and they've come for advice. So how long do you wait before you take any further step? How long should a couple that seems apparently healthy try to naturally conceive before they even start considering any testing or procedures?
A woman in her 30s who has been trying for pregnancy for the last 6 months and everything else looks okay on her reports, I would now start her on those special investigations to figure out why things are not clicking.
6 months, you're saying. Okay,
Yes.
great. And just again, demystifying the age aspect, Dr. Bhavna, that you covered a few times. So, how big a risk factor is age, and when does it really cross the red line?
See, the ideal age group to conceive is before the age of 30 years. After 30, the fertility declines, right? It starts declining, and we see a very sharp decline after 35. So, I would advise all the young people to start thinking and planning before 30 itself, right? So, the red line is certainly 35.
Got it. And what about men?
Yes. See, men sometimes are in a thought process that we do not have a biological clock. We discussed it earlier, but certainly there is a clock ticking for them as well. And somewhere similar to the women, 35 to 45 is a time when they also experience a significant decrease in the semen count and the quality of sperms, the motility of the sperms, everything gets negatively impacted for them too.
Got it. And now just giving some hope to the audience. If people are, say, about 35 or even, beyond that, is there still hope, or one should sort of consider, that they've crossed that age?
There is certainly hope. The fertility decreases, but I never said it becomes zero. So what I'm trying to educate people is that please be aware that there's a clock ticking, and this clock is in conflict with your career clock. So while you're focusing on careers, please bear it in mind that there's this biological clock which is going the other way. So focus on a mindful eating, focus on a healthy lifestyle, and and for girls, if they are trying to delay their pregnancy for later on, at least think about egg freezing now.
Okay. And what is a good age for egg freezing, Dr. Bhavna?
See, the best time to do, as I said, the quality of egg is the best before the age of 30. But then there's a test called the AMH, which can be done to check the ovarian reserve from time to time. And best is before the age of 30, going for egg freezing. But then there's a saying, jab jago, tab savera. So if you've missed the bus, please get your AMH levels checked and go in for an egg freezing, even if you're on the other side of 30.
Okay. And what do AMH levels indicate? What levels mean that you can still freeze your eggs?
It's not an absolute thing. See, the normal range according to lab parameters mostly is 2 to 6, but it is not the only criteria which would determine your ovarian reserve. There are other things like the antral follicle count, and a single reading also is not absolute.
Got it. Okay. So we touched upon very important topics, Dr. Bhavna, and just before we go to the IVF process itself, which is a big elephant in the room waiting for us, I wanted to just cover the egg freezing, embryo freezing aspect a little bit more, right? If you can demystify this for our audience, what does egg freezing and embryo freezing mean? What are the differences? Which one to opt for? Why to opt for it?
Okay. See, nowadays the background is that young girls, they are focused on their careers, and rightly so. Yes. So the thing is, they should think about egg freezing well in time. So what we do in egg freezing is that we preserve the unfertilized eggs. So if I talk in layman terms, we give certain injections to achieve the development of multiple eggs, which we then retrieve, and they can be frozen for a very long period of time, and whenever required, like whenever the girl is now prepared for her pregnancy, these eggs can be thawed and then they can be used for conception. Now this is a very good option for girls who have not yet chosen a partner. They are not yet decided when they are going to conceive. Compared to this, what happens in embryo freezing is we take the woman's unfertilized eggs, we take the sperm from her partner, we fertilize this in the lab conditions, and we develop embryos, and then we freeze these embryos. Now the difference is, one, we have got unfertilized eggs, on the other side we have got fertilized developed embryos. The embryos compared to the eggs are more robust, they are more rustic, right? So the results of a pregnancy are much better with the embryo freezing compared to the egg freezing, right? And there is one other benefit of embryo freezing, that we can do a pre-implantation genetic testing on the embryos. That means if there is a history of some genetic disorders in the family, then in the embryo it is possible to check for some of those, right? The downside with embryo freezing is that girls who are yet unmarried, who are not yet decided on the partner, they cannot go in for an embryo freezing. For them, the better option would be the egg freezing. Even though the eggs are more delicate, the results with egg freezing are slightly lesser than with the frozen embryos.
Great. One follow-up question on that, Dr. Bhavna. So this egg and embryo freezing, eventually then you have to go through an IVF process to get pregnant. And what's the success rate there?
Again, the success in the IVF is dependent upon multiple factors. And most important again is the age of the lady, the timing the eggs were frozen, and what is her current age and what is her current medical condition would determine the success of IVF.
Got it.
So in good centers with a young patient, the results are excellent to the tune of 40-50% also. But then there are many variables to this.
Okay. Now coming to the elephant in the room, which is IVF, right, Dr. Bhavna? And it has become such a common trend in cities like Delhi, Bombay, Bangalore, right? There are IVF clinics at every corner now, right? There are B2C marketing campaigns we keep hearing and getting confused, right, as women and even men. So IVF is meant for whom, right? Who should consider IVF, and what is really the process, right? And how does one prepare themselves emotionally?
Good question again. See, a lot of women nowadays need IVF because the incidences of problems are increasing, because the age for conception, people put off their pregnancies for a later date, and then there are a lot of issues that crop up. So women with severe endometriosis, women with blocked tubes, then women whose partners have got severe issues, the sperm comes out really low, or there are ejaculation failures there, or other issues with the male partner, are the ones who would certainly need help in the form of IVF.
Okay. And what does this process entail, Dr. Bhavna? How long, how many cycles, and how does one prepare for it?
See, it can be an emotional roller coaster ride for both the partners. So yes, one, they have to be really prepared emotionally, physically for this journey. And we always say that before you are planning for an IVF, give yourself a couple of months to focus on your general health. So if you are slightly on the obese or the overweight side, it makes sense for both of you to shed a couple of kgs, but in a healthy way. Focus on mindful eating, do things that de-stress you. Believe me, that would significantly improve the results of IVF. So that is how you can prepare for it.
Right. And Dr. Bhavna, in layman terms, if you can explain the process in short for our audience.
Okay. So in this, what we do is, in the female partner, if we talk in a simple way, we first give her medications to develop multiple eggs, and mostly these medications are in an injectable form. So by this we are able to achieve the development of multiple eggs in a single cycle. Then by the process of ovum pickup, under the ultrasound guidance, we do the collection of these eggs, and this is done under short general anesthesia. Then the partner's semen is taken, and these eggs and sperms are then fertilized in the lab, and they are developed to a certain stage that is called the embryo, and these multiple embryos are then cryopreserved. And then we, depending upon the number of embryos we are able to freeze, we then plan the IVF process, wherein the embryo transfer process, wherein this fertilized embryo is then transferred in the woman. And before that, we prepare her endometrial lining by giving some hormones. So usually this cycle is split in two. that in one cycle we do the ovum pickup, freeze those embryos, and in the subsequent cycles we can then plan the embryo transfer.
So how long in months are these 2 cycles, Dr. Bhavna?
Usually it's 2 or 3 months cycle, not longer than that.
Got
and
it.
Mostly the first chance is a very good chance, but if it doesn't work in the first time, then the embryos that we have preserved can be used for in the subsequent cycles.
Got it. And you mentioned it's a 40 to 50% success rate.
If young patient, young couple, no comorbidities, then yes, very good success rates.
Okay, and in your usual experience, because you have so many patients coming to you every day, how many, on an average, how many months does it take for a couple trying for IVF to be successful?
As I said, there are many variables to it. Some people would conceive in the very first cycle, and in some people it may take many months of trying.
Got
so that simple question doesn't have a straight answer, I must say.
Got it, Dr. Bhavna. Thank you so much. Now, Dr. Bhavna, just talking about success of the pregnancy, right? We have seen in cities, right, a number of cases of miscarriages, also genetic abnormalities, for example, right, in women. So, does that also have a correlation with age? Secondly, is there a higher probability of these issues in an IVF pregnancy?
Yes, first question first. You rightly pointed out that with advancing age, the incidence of miscarriages and incidence of malformations, chromosomal abnormalities certainly significantly increases. So if I give you an example of some syndrome called the Down syndrome, in which there is trisomy of chromosome number 21, the incidence in a young girl who is in her late 20s would be somewhere around 1 in 1000. And by the time she is mid 30s, the incidence goes up to 1 in 250. And when she's around 40, the incidence is almost 1 in 90 to 1 in 100. So the age is the single most important criteria which significantly increases the risk of miscarriages, malformations, genetic problems. It's because the DNA gets affected over a period of time. There are subtle changes in the DNA, something that we call mutations, and that can have an impact on all of this.
Got it. And is there a difference between IVF and non-IVF pregnancies on the probability of these issues?
Age is the single most important criteria. It has been observed that in IVF pregnancy slightly increased incidence is there. Maybe it is because that already the couples who are going in for IVF are dealing with a lot of hormonal issues, a lot of other issues, so which could be contributing to it. So yes, incidence is slightly higher in some studies, but we cannot pinpoint it solely to IVF. It could be related to the issues which are contributing to the infertility, also could be contributing to her increased risk of miscarriages and malformations.
Got it, got it. And Dr. Bhavna, last point on that, the health of pregnancy, health of the fetus and health of the child eventually, is there any difference between an IVF, non-IVF pregnancy?
No, they are mostly similar. If there are coexisting comorbidities, that if the woman is, see, the IVF patients by and large tend to be older in the age group segment, tend to be having coexisting other issues like diabetes, hypertension and all. So those could be contributing to the overall negative impact on the well-being of the fetus. But per se an IVF and otherwise a normal pregnancy behave more or less in a similar way.
Got it. Great, Dr. Bhavna. I have a couple more questions. Thank you. This has been so engaging. I wanted to also understand a little bit around this entire advent of C-sections and how, there are reports on it is much more practiced in India versus the West. And, we have lost the normal delivery culture. So what is really the reason of this increase and how could we contain it?
See, the increase in cesarean section is global trend. It's a global trend. And to say that it's more in India, less in Western countries, no. If we talk of the data of cesarean section in India is around 21%. In Europe, it is 35 to 45%. In
Latin America and South America, it is almost somewhere around 40%, and so on. But yes, you're right. The trend in urban India compared to rural India, urban India, certainly we are seeing a rising trend for cesarean sections, and there are a number of reasons for it. One, the incidence of high risk pregnancy is increasing. Again, everything boils down to late conceptions. So when somebody is going for a late conception, her chances of having other problems, high BP, other medical disorders, hormonal imbalances, fibroids in pregnancy, everything increases. So because of that, it becomes a high risk pregnancy. So naturally, the rate for cesarean section certainly increases. Then there is something to do with our pain threshold also. So sometimes that phobia of normal delivery pain also puts off many women. I mean, they sometimes choose to go in for a straightaway cesarean also. Although they should know that now we have got something that we call painless delivery. We have epidural analgesia to help them out during that severe pain of normal labor.
And are these anesthesia like epidural absolutely safe, Dr. Bhavna?
Yes, it's quite safe. Yes, it is quite safe, and it's really helpful. I mean, it mitigates the pain significantly and improves the normal delivery rate.
Yes, I've taken it myself for a normal delivery, so I know. Thank you. And one more question, Dr. Bhavna, which is related to post-delivery process of umbilical cord blood banking, which has become a trend, but again, there's a lot of myths and questions around it. So what is your take on it?
See, umbilical cord banking, there was a lot of hype about it a couple of years back. See, many years back, we did not know the advantages of placenta or the stem cells that is present in the umbilical cord, and simply the placenta and the umbilical cord were being thrown away. Then we realized that the umbilical cord contains these stem cells which can be used in the treatment of a number of problems, and then a couple of years back we thought that yes, this is the answer for so many things, and then everywhere there was this noise regarding going in for the umbilical cord banking. But see, it has got its own limitations. It can be used in very limited number of cases, the way it is being practiced currently. See, nowadays we have these private banking. The public banking is not available. So in private banking, the indications for saving the cord are very minimal. See, let me tell you in a simpler way. These stem cells can be used in the treatment of certain genetic problems, certain cancers, and certain immune issues, right? And in private banking, this sample can be used only for that child and the siblings and that particular family, right? Now for the child whose cord cells we are preserving, now if we need to treat some genetic condition or some malignancy in that child, we cannot use that same blood, those same stem cells for the child. Reason being, those stem cells would have that same problem, same genetic conditions, and same pre-malignant cell line in case she is being treated for some cancer. So that cannot be used in the same child, right? So the indications, so the future benefits of this sort of a banking we really do not know.
And it's quite expensive, right?
It's quite expensive, yes, of course. And it can only be used in certain conditions for certain family members. I mean, if you have a family member who has some condition and the treating doctor feels that for that person, this stem therapy would be of some benefit, yes, then going for that stem cell banking. Otherwise, right now, futuristic, we do not really know. Although some years earlier, we were promoting it a lot, but lately, of course, I would say something about the public banking, wherein it is collected free of cost for everyone.
So larger group.
Yes, for a larger group, we have a big pool of it, wherein these samples are available to anyone. So there, the chances of a match are better and it can be better utilized.
That would
So
be great, actually.
that
Maybe
would be
we go
great.
that path. Great,
Yes.
great. So, Dr. Bhavna, we'll take a couple questions from our audience, and then I'll have a small question for you to answer after that. One question we're getting is, on IVF itself, why does it lead to twins a lot of times, and can one choose to have twins with IVF?
Well, it all depends how many embryos are being transferred. See, best is to introduce only one embryo so that we end up having a singleton pregnancy, because that is safer. Twins happens when we are putting in multiple embryos there, and then it becomes a high risk pregnancy. So I won't advocate putting in multiple eggs and multiple embryos and achieving a multiple pregnancy.
Got it. And another question is, does IVF always need a C-section?
No, IVF doesn't always need a C-section. If it's a low risk pregnancy, everything is going smooth, yes, we should go in for a vaginal delivery because that is more physiological.
Got it. And one last question we'll take, Dr. Bhavna. Are there any other assistive processes which are less invasive than IVF for women?
Yes, see, if we can go in for an IUI, intrauterine insemination, if the woman has got healthy tubes and we just want to improve her chances of conception, she's experiencing a difficulty in conceiving and there are no major issues, we can go in for an IUI, intrauterine insemination.
Got it. Great. And the one last question I had for you, Dr. Bhavna, is you have had a fabulous career. You've studied for years and years. How did you manage your career with family life so well? If you can share that with our audience.
Oh, I have been very lucky that ways. Thankfully, I had a lot of family support from both my mother-in-law and my mother. So it was a smooth journey for me, and I wish and hope that everybody has a smooth journey like this.
Okay, great. Thank you so much, Dr. Bhavna. This was really enlightening for our audience, and what amazing topics we covered on Women's Day to empower her and him both. Thank you to our beautiful audience for joining us on Conversations with Zyla. It was a real pleasure hosting you today, and we look forward to many more such insightful sessions. Till then, good night, take care, God bless. Thank you.